Can having a concussion cause you to have digestive issues, even digestive issues that persist well after having a concussion? My name is Dr. Paul Hrkal. I'm here to talk about the gut-brain connection and how that might be impacting some symptoms that you might be experiencing right after a concussion, and then even weeks, months, and years after a concussion. So we know that in our gut, there's an entire nervous system called the enteric nervous system. This is a connected nervous system to the brain, but it is separate and independent. You can see it here in this really neat graphic showing the brain and then the nervous system connections through the spinal cord and the main nerve called the vagus nerve. Now, the vagus nerve is getting a lot of attention because it is the main informational highway between the brain and the gut. And it plays a key role in a lot of the symptoms and dysfunction that happens after you sustain a brain injury, because this delicate communication network can become dysregulated and imbalanced. So in my clinical practice, I can tell you that I see patients frequently that have digestive issues. But the most common one that people get is nausea right after sustaining a concussion. And that is a normal symptom because of the nervous system dysregulation, as I mentioned. And nausea is one of those things that happens because when the digestive system isn't being connected and then innervated ideally, then you're going to get a slowing down of the digestive tract, and that leads to nausea. However, there are other symptoms, and to help us shed light on these other symptoms, there's a really recent study that did a pretty good job of sharing some of those. This was a study done among Irish athletes, and they wanted to evaluate in around 106 athletes using a questionnaire style of what types of digestive symptoms that they might be experiencing right after a concussion, and then also months and years later. And so what they found was interesting because they noted that the majority, not over 90% of people that were polled in this survey had at least one digestive symptom. And the main ones were appetite loss, bloating, and abdominal discomfort. They also found that females had a greater chance of having these symptoms based on the self-reported data. Let's take a bit of a closer look. So you can see here in this graphic, the yellow or orange bars show the percentage of people asked that had digestive symptoms. And then the blue bars were those that didn't have it. And so as you go from the bottom, symptoms like increased tiredness, almost 90% of people had that symptom right after a concussion. But then the ones I just mentioned, like loss of appetite, nausea and vomiting, food cravings, even abdominal pain, discomfort, stomach bloating and distension, and an increase in flatulence and wind were up to 50% or over 50% of people that were polled. That's a substantial number of people. So what this study shows is what I've seen in my clinical practice, where definitely digestive symptoms do occur, and they can occur quite frequently in a large percentage of people that sustained a sports-related concussion or a mild traumatic brain injury. A lot of these symptoms like constipation and diarrhea, increased gas, abdominal discomfort, these are common symptoms that overlap with conditions like irritable bowel syndrome, which is one of the most common digestive conditions in the world, has a multifactorial underlying root cause that does also have a neurological connection. So we know from studies in IBS that people that are under more stress have an increased risk of having an IBS symptom flare. But then there's some other things here, like they looked at psoriasis and eczema, acne and rosacea, new food sensitivities. Any disruptions in your microbiome, the bacteria that are present, play a regulatory role, not just at the level of your gut, but also in creating and producing inflammation through the whole body. So you might be asking, how is this possible? How is our gut so affected after sustaining concussion? This diagram I've used a lot in my presentations because it does a good job of pulling together a number of pieces of evidence that show right from sustaining the primary injury, a concussion, you're going to get an immediate activation of immune cells called microglia, and that leads to very rapid changes, not just in brain tissue, but also intestinal permeability. And the idea there is that the body's trying to increase inflammation, and one of the main mechanisms to increase inflammation, which has a healing property, is to make the gut more permeable. That allows more inflammatory molecules to get into the bloodstream and ultimately make it to the area of the injury. And this is where you can get some of this persistent neuroinflammation. The big takeaway here is that it occurs quickly. 3 to 6 hours after sustaining a traumatic brain injury in mouse models. And I think the more severe the brain injury, it stands to reason that I think this is a stronger response. And it lasted up to 7 days. And what this Irish athlete study that I just talked about shows us is that sometimes these symptoms can last even much longer than that. This just looked at the intestinal permeability, but there's also the negative effects of that. And in some people that are predisposed to maybe having gut issues, and we don't fully understand who some of those people are and what some of their characteristics are, but they seem to have sometimes long-lasting effects. I really like looking at this from different graphical perspectives. And this graphic kind of looks at it from a bit of a more mechanistic perspective, showing again the initial traumatic brain injury, activation of the immune cells, and then having a not just an inflammatory response locally, but through these complex gut brain. And also this diagram shows the connection between our body's stress system, the HPA axis, that's the hypothalamic pituitary adrenal axis. And this is a hormonal axis that is upregulated when we deal with any sort of stressor, including a brain injury. And that can have an immediate effect. We know this sometimes as fight or flight. And this can happen almost instantaneously, within seconds after sustaining some sort of car accident or athletic injury. And that can lead to, through these hormonal signaling changes, to gut dysfunction, leakiness. So there's a connection between your brain being dysfunctional and leaky and inflamed, and also your gut. And then that leads to microbiome changes. So I think the key takeaway here is that there are changes that happen. There's definitely symptomatic issues that people can experience, not just right after a concussion, but even months later. And this may be an area that more research needs to be done to not just reduce the symptom burden, but also potentially intervene at interrupting this inflammatory leaky gut pathway, because it does play a key role in not just the ongoing symptoms, but maybe in the resolution of symptoms. We still don't fully know this, but definitely is an area for us to consider. So just like the father of medicine, Hippocrates, said, maybe all diseases begin in the gut. Maybe concussion is no different. Definitely food for thought. And we should be looking at this from a scientific perspective to have a little bit more research. And you that are listening to this may want to look at working with a naturopathic doctor or a functional medicine doctor or a gastroenterologist if the symptoms warrant, to address some of these issues, because they may have come on because you've sustained a concussion, even though they're in your gut.